FHIR is an open standard and the community is contributing to the development of the standard, you're able to really understand exactly what's working, what's not, what do we need to improve on the next iteration, what do we need to perhaps, what do we need to perhaps with regards to the next release of FHIR. And it's just process that's really self-governing in a sense, because it is that open standard, you have the best practices and the community contributing their expertise. Whereas with past healthcare data standards, there definitely was a community process, but not as variegated and diverse as the one we see with FHIR. Now, the standards continue to grow, and as healthcare continues to evolve, the standard continues to evolve with it.
What would you
One
guys
more
say
thing that I'll add.
they're putting things on hold is, they're waiting. What would you guys say to that?
I would say get onto it immediately, not just because there are compliance deadlines coming up, also because being ahead of that is not only going to allow you to kind of settle yourself early when it comes to those compliance deadlines and changes that are likely to come immediately after their implementation, but I think also it allows organizations to really be adaptable in a technology environment. If there's a new vendor that's coming out with a piece of software that could be really beneficial to you, but historically has been out of reach because of the integration requirements or the interoperability requirements to use it, now, if they are FHIR compliant, which every vendor, I think, from a healthcare perspective should be working towards, it becomes a lot easier because now you're like, okay, cool. What resources do you need? I need the patient resource. I need the observations, depending on what exactly it is they're doing, the encounters, conditions, allergy intolerances, or do you need things like the claims, the explanation of benefits? Do you need coverage and your eligibility, right? All that kind of stuff. It's very easy to all be speaking the same language rather than starting to talk about, the Meaningful Use Guide has these data elements and how are you going to send us these data elements? It's like, no, which resources do you want? And you can pass it over.